Okay, so the first one that we are going to go over is the need objection role play. So go ahead.
All right. We don't need the project management team that you're offering. We have our own study team to run the trial.
Most other pharmaceutical companies have their own study team too. How do you plan to address all of the direct contact from sites with questions, concerns, and technical assistance?
Well, we have staff members who we plan to have address all those incoming emails from sites with questions.
That is a great plan, Jane. However, what if I told you our product study team directly answers all inquiries from sites so that your team can focus on other aspects of your study?
It seems like such a simple task to answer site inquiries on our own. How would your study team benefit us?
Well, Jane, it becomes tedious to answer all of the inquiries that you may receive every day, especially when sites ask about issues related to our specific products, services, and processes. We have a highly trained team in which they can answer even the most complicated questions a site may have. We also have a study-specific email that sites can contact to ensure that general inquiries or concerns are addressed in a timely manner. This type of contact can be quite time-consuming. So with Vitalograph taking on all site contact, your study team members will be able to focus on the other details of running your trial. Wouldn't you agree that it would be more beneficial to have your team members working on other busy aspects of your study? The second objection that we're going to go over is product service objection. Go ahead.
The Breathe Better respiratory representative visited us the other day and showed me their new spirometer machine. Is that right? Is that right?
Spirometer.
Spirometer. I don't know. That's why I have employees.
I probably should have went over that with you first.
That's why I have employees to take care of that for me. I like their software better though.
Okay. They do engineer great software. Jane, what is it that you like specifically about their software?
It seems much easier to navigate, and I like the layout of the software.
That is true. They did make their software easier to navigate. The layout of their software is simple, as you can see, but their software does not have the full range of functionality or customization that Vitalograph can offer you. Vitalograph can fully customize your software to almost any of your requirements. Our experienced teams of software engineers are experts in delivering optimized software solutions to meet your specific protocol and operational needs. This customization capability, coupled with flexibility, speed of response, and personal service, means we can provide systems that consistently deliver accurate data on time and on budget. Have I resolved that issue? Okay. So the third one we're going to go over is source objection.
Vitalograph is a small company compared to Breathe Better Respiratory.
Size is definitely something to consider. Could you please be more specific, Jane?
Well, they probably spend a lot more money in research and development than Vitalograph does.
You may be right, Jane. I'm not sure how much they spend in research and development. What I do know is that since 1980, Vitalograph has utilized PC-based solutions and more recently, the Compact Medical Workstation to capture data electronically. The solution is the most advanced, secure, and integrated data capture platform in the industry. Our clinical trials partners enjoy the peace that comes from our 50-year history of researching, innovating, and developing high-performance cardiorespiratory devices, which we have delivered and supported globally in clinical trials. Our success in delivering effective, high-quality clinical trials data and providing operational efficiencies is reflected in the fact that the majority of our clinical trials is repeat business. So you can be assured that when you contract with Vitalograph, the best technology that we have to offer. Do you agree that this isn't a problem? And then the fourth one we're going to go over is price money objection.
What kind of prices am I going to be looking at?
It would all depend on the contract drawn up and the services required. This can be discussed.
I'm not sure if your prices will be in my budget.
I'm glad you raised that issue, Jane. What kind of price range is your budget worked around currently?
Definitely under 750,000.
Increased competition, stronger regulatory pressures, and growing concerns regarding drug safety are making the clinical trial arena even more challenging. It is estimated that on average, it takes more than 10 years and over $1 billion to get a drug to the market. Failure rates for early compounds are estimated to be around 85%, and only 50% of those make it to phase 3 are approved. With all these challenges, it is important to select the right people to support your trial. Our expert study personnel around the globe will work closely with you to ensure that your trial runs on time, to scope, and on budget. We must definitely work around your budget and get you where you want to be, Jade. Considering these factors, would you agree Vitagraph is of good value?
Sold.
The last one is time objection.
Oh, we're not done. Okay.
Did you end it?
Nope.
Okay.
It's only December. Why don't you come back after January?
I understand how you feel. When do you plan on starting out the study?
Around mid-November next year.
In past experience with other clinical trials, it's best to begin figuring out third-party services and products as soon as possible. This ensures that we can have time to customize your software, order equipment, write study-specific documents, and draft up an acceptable contract. Having this in place will help your trial run smoothly and get off to a good start early. If you wait much longer after January, we will have a more difficult time ensuring that all aspects of your study are running on the timeline that you have outlined for us. This can cause problems for the study later on. You don't want to steer away from your timeline and not have the right resources in place. Am I correct, Jane? And that is, yep, go ahead.
Okay. Oops.